Upper cervical care and brain development. I want to take a few minutes and talk about a very specific aspect of brain development and the important role that upper cervical care plays in normal brain development. The first place to start is to look at the development of the brain. When we look at the brain itself, here's the brain, the nose, and the mouth, and the brain stem. When you're first born, the brain stem is 100% formed. It really has to be, because this is where all of our vital centers are. This is where our cardiorespiratory centers and whatnot belong. The brain, the cortex itself, is only 25% of the volume weight that it will be as an adult. The reason why this is, we're bipedal, we walk on two legs. The pelvis is shaped in such a way that the head necessarily has to be small when it comes out. So the cortex is only 25% of its weight. An amazing thing happens. By the time you're 6 years old, the weight of your brain is 90% of what it will be as an adult. So there's a massive amount of growth and development that takes place in the first 6 years. And these 6 years are pivotal. Of course, the first 20 are pivotal, but the first 6 especially are pivotal. Let's talk about this right here. First, when you look at it, there's two things that really drive brain growth. Number one, it's our 5 senses. That is one thing that drives the brain growth, and gravity is the other. Gravity is what provides the power for the brain to grow, and the 5 senses really provide the experience. You must have the experience and you must have the power. Those two come together for normal brain growth. And the way it happens is this. Here's the brainstem, spinal cord. Down here, gravity is activating the proprioceptive system. And primarily, it's the muscle spindle that gets stretched during gravity, and the tone of the muscle and the muscle spindle fiber fires into the brainstem, and then this provides power for the brain. That way, when you see something, when you hear something, or anything coming through one or more of the 5 senses, you can take that information and you can grow brain networks based upon the power that's provided to actually do that. Now, let's talk more specifically how the brain develops from bottom up. First, it starts with the muscle spindle. The muscle spindle feeds into the cerebellum. The cerebellum, in turn, sets the physiological tremor, which is when the muscles turn on and off 8 to 10 times, 8 to 12 times per second. It can be imperceptible by the naked eye. The cerebellum also feeds into the thalamus, and this is what sets the oscillation rate. The oscillation rate is measured in hertz, and if you have 40 hertz, it means that your brain is turning on and off 40 times per second. It's a great way to conserve energy. If you have a child with ADHD, anywhere on the spectrum, OCD, or any of the brain developmental delay issues, they're generally going to have low or slow or weak oscillation rate. When this happens, when they see something, when they hear something, taste or touch, or anything through the 5 senses, they're not going to perceive it as well because the oscillation rate is not strong enough, and they don't have the power to build appropriately the brain networks that go with that experience that they had. So when we look at it, the muscle spindles feed the cerebellum, and then the cerebellum really is what's setting the oscillation rate. Keep in mind, the upper cervical spine is absolutely rich with muscle spindles. You also get activation from the core muscle strength. These are the two areas that primarily feed into and activate the cerebellum to actually drive that oscillation rate. Here's a study they did in India where they were looking at the quantity of muscle spindles per gram of muscle. And what they found was overwhelmingly in the upper cervical spine, the suboccipital muscles were very rich in muscle spindles. This is one of the reasons why upper cervical care is so important for the developing baby and the developing brain. If this upper cervical region is off, this is really going to mess with the oscillation rate, and this is going to cause problems with that brain development. I invite you to join along with us for this online course. It begins May 2nd, 2019. You can go to Pro Health Seminars and go to the top of the page, and you're going to see a link that says UC Neuro on that. Click on that link. It'll give you an outline for the course as well as a summary and a way to register. We're going to talk about a lot more than just brain development. We're going to talk a ton about the brain. You're going to learn a lot about the brain and body physiology. You're going to learn about the autonomic nervous system and how it relates to the upper cervical spine. You're going to learn about dementia, Parkinson's, concussions, and a lot of other things. But mainly we're going to teach you how to do an exam that's appropriate for your upper cervical work. Something where you can have assessment points to understand the impact your upper cervical is having on the patient's brain as well as the body physiology.